Okay, so today we are going through the medical and dental school personal statement workshop. So I guess first for my attendee, are you planning to go to medical school or dental school?
Medical school.
Nice. So I'm assuming you're part of this application cycle,
Yep.
which is awesome. And so this will hopefully be helpful no matter where you are in the process. We'll really start from the beginning, but you can kind of jump in where you're at. So First of all, I think it's important to frame the presentation by talking about what is a personal statement, right? So the medical school application process can be confusing and there's lots of different parts. So if you're going through the first time, you're probably learning as you go, which makes sense. And that's part of the reason we're here to support you in health professions advising. And personal statements are just one piece, right, of your overall medical school application, and they're part of what we call your primary application. So you write one personal statement and it goes in your application, and every medical school you apply to sees the same personal statement. So that's the process. That's a little bit different than your secondary applications, which you'll get after you submit to your primary, which will then have what we call secondary applications and questions. And those are unique to each school. So you'll have to provide answers based on the school specific questions. So that's the difference there. Is these personal statements, it's one for all of your schools, which kind of makes it harder, right? um, but the big question you want to answer is why medicine or why dentistry? If that's your goal, that's the big overarching question. And you also want to make it personal. So every personal statement I read is very different. People approach it with different themes and different ways. And a lot of that is really good because you do want yourself and your personality and your passion and drives to come through in your personal statements. So it really should be unique to yourself and bring in kind of your own personal touch. Okay, so just a couple do's and don'ts. So typically in a personal statement, we want it to be easy to follow, organized, clear, and concise. This can be something that can be really hard. And oftentimes, when we're working with applicants on drafts, a lot of the work is just around like making it more concise while getting the same point across because we only have a limited amount of space, right? So that's a big thing to work on. Hopefully, you'll follow a theme, and we'll talk more about that. And then obviously, we want it completely clear of errors. So we definitely recommend this anytime you're writing a statement or a paper, right? For anything, is to have multiple eyes as proofreaders. So you may have um, myself or Cindy or your MPEC advisor. You really like dive into your personal statement, give you a lot of feedback on the content. You may have someone else, like a friend that's was an English major, go over it for grammar and spelling like a couple times, or maybe even a family member or a parent, but it's nice to have multiple eyes because it'll have multiple readers. So you want to make sure that you've caught everything that needs to be fixed before you submit that application with the personal statement. And then personal statement don'ts. So you want to try not to be generic. We usually typically say don't include quotes. They really wanna hear your own words, right? So to bring in someone else's words, might not be as relevant as hearing directly from you. And also sometimes, we worry about, making sure that things are cited correctly. We don't want any room for error if you're including, quotes. So we try to avoid those. Try not to focus on the negative if you've been through a challenging experience and you wanna include it. I think that can work sometimes, but we don't wanna just solely focus on what has been hard, but more on how you've overcome. Um, so try not to cover everything. So this is something that's hard to do because you really have to, choose a theme and a couple examples of what you've done so far, but you certainly cannot include everything about your life, right? And I think that's an important thing to think about. Um, yes, and that's a hard, hard part. And so we can kind of talk about that. I think like big picture, to if you think about the personal statement as just one part of your application, right? So you also have your activities section where you're going to have listed everything, all those different activities you've done, including your volunteer work and research and clinical work and shadowing. So there's a lot of space for that. And then there's also space for you to talk about these things in your interview, which is another place, and in your secondaries. So they are looking at the whole application. It's a holistic approach. So not having everything in the personal statement is okay because you're going to have it in other places as well. And then, of course, you want to try to avoid leaving anything vague or something that could be misinterpreted by a reader. And again, that goes back to why it's good to have multiple different eyes on it that have different perspectives, because they might say, like, oh, I don't even know what you mean by this. And that might not even, um, you know, have been something that you or I had thought about until that other reader took a look. So, um, again, proofreading over and over again is important. And some of the hardest things to do with the personal statement is just get started because it's kind of an overwhelming task. And so today we are going to allow for some time for some brainstorming. And the applicant and I that are on the call will do some verbal brainstorming, which can be helpful as well. I think written brainstorming, if you're alone, solo, is very helpful. But if you have a chance to meet with an advisor or talk to a friend or colleague, talk through some of these things, that can also be really helpful. So, the number one thing I would have you start with is just to take some time to reflect, right? So, that's why we say early on if you can keep a journal of the things you're doing or the experiences you're having, how these things are making you feel, and how they are creating motivation for you to become a future physician. All of that writing is important. So, even if you haven't done it yet, I think starting some writing now about what got me to this point? Why am I interested in medicine? What makes sense as far as sharing my journey and where I want to go and who I want to be. And that doesn't mean it's going to end up in your personal statement, but just some initial writing is going to, or talking through this will help you create some bullet points or outline kind of what you want to say next. And it's really important to go into this process knowing that you'll have lots of edits and lots of drafts, right? So typically going back and forth with people for feedback, quite a few times, maybe a handful of times or more, and going back yourself and maybe rereading it and saying like, at first, when I wrote that, that sounded good, but now that I'm back in here, I'm not loving it, right? And that's fine too. That's an important part of the writing process. So give yourself enough space and time to do multiple drafts as well. It also helps some applicants to write more initially. So if I meet with someone and they're struggling on a theme or an idea, I'll just have them write out a couple of them and kind of, write it this way, write it that way, right? It's a little bit more work in the beginning, but once we see it all, we can kind of say then, oh, yeah, this makes sense. This part I think we can leave out or include somewhere else throughout your application or secondaries. So sometimes writing more at first, knowing that you're going to pare it down, um, makes sense as well. Or you may want to start with a bullet point outline and write from there. So there's different ways to do it. But again, keeping in mind that that's really the first step in the process. Okay, so as you're brainstorming, obviously, a first question we want to ask is why do you want to be a doctor or a dentist? So, for those of you that are watching the recording, we'll pause here and give you about 15 minutes to think about this actual question and write down a couple of ideas. So, while you're thinking about this big question of why doctor, why dentist, also think about things like what set you on your path to medical school? Was it a specific person or experience, right? Was there a series of events in your life that led you to this point? Thinking about impactful experiences, or any hardships or challenges that have influenced you. Some folks will include a little bit more about their background if they have had direct personal experience with the medical or healthcare system in a certain way that they want to share. And that's great. So, thinking about those additional questions and as you do, how they relate to the big question of why you want to be a doctor. So now we are going to go into some examples of what you might have written down for your initial brainstorm of why doctor and dentist. So, for example, you may have thought of something like, oh, I want to serve my community, and there's a lack of healthcare providers who represent my community members. That might be something that came about. I want to use my engineering background to help patients by solving physical challenges they experience. I want to pair my research skills with patient input to provide the best care possible. So again, these are all really different because they're based on you and your own experiences. So you want to make sure that as you're writing these things down, you think about really what is the theme for you specifically. And if you need more support in coming up with that, certainly doing some brainstorming with one of the advisors can be really helpful as well. So as you look back at what you've written down, do you see any themes? So as Brogan and I, who is on the Zoom, talked, we kind of realized that one of their themes might be service, right? And giving back and being able to have witness kind of what's underserved populations experience in healthcare and wanting to serve them as well. But that idea of service and giving back, that's a theme, right? And so as you look back at what you've written, um, see if you can find any themes. You might circle important components or important words that stick out to you as something you know you want to mention in the statement. But if you don't see a theme, continue writing, continue brainstorming, continue talking. And eventually, I think, something will emerge. And then always keeping in the back of our head as we're writing the question of why you want to be a doctor, right? Sometimes we get carried away, we start just writing, and then we're like, wait a minute, am I actually answering the question? So having that question like on a sticky note next to your computer or on your computer to just remind you, this is the question I need to be answering. So a theme is important because it's a central idea that kind of ties everything together. So here's an example. For example, if you volunteered at Ronald McDonald House and did research on pediatric cancer, your overall theme might be your interest in scientific and humanistic sides of working with child patients, right? So although it's two different experiences, it kind of follows this theme of um, science and working with younger patients. So again, that's going to look different for everyone, but as you start looking at some of the things you're writing down, see if anything pops out to you as a potential theme that can kind of tie your personal statement together. Okay. So the next part of your personal statement, after you've kind of thought about how you might start it and the theme that might come through, you want to think about 2 to 4 experiences that support your claim of why you want to be a doctor or dentist, right? So if you're saying, I really want to serve people, give back to my community, what have you done? What have you done in college? Did you volunteer for a certain organization? Did you do some research with a faculty member that focused on something specific that is related to your theme? Did you do something in your gap time where you were able to serve others? Or did you shadow a doctor or have a more like volunteer shadow experience where you saw something like this happening? So there's lots of different ways you can provide that evidence, but you definitely want to talk about now what you have done and show, not just tell, that this is something that you wanted to do in the future. So as we continue this brainstorm, thinking about what you might include in your personal statement, you can think about an accomplishment you're proud of, your unique background and life experience, significant mentors. So, if anyone had a really big impact on your life that you want to mention, your areas of work, so your research, volunteer, or clinical work, or work with diverse population sets, which may be part of the theme that you're working with as well. So I'm going to pause the video again and allow you to take 10 minutes now so you can kind of time yourself and brainstorm around your supporting evidence for why you want to be a doctor.
Yes.
Okay. What'd you think of the kind of the beginning here?
I thought that it was a like enticing beginning. It made me want to read more.
Mhm.
Um it's definitely like kind of like you said, it's definitely showing and not telling.
Mhm.
There's like a lot of good description, I think.
Yeah. Yeah.
Um
Yeah, I agree. So I think, and that's one of the things that you can kind of think about as well as someone starting to read your personal statement, are you kind of pulling them in as a reader and getting them excited about what you have to say next? And sometimes that comes by using a specific story, like in this case where she's talking about her patient Anna.
Yeah.
Yeah. Um, and then this next paragraph is really a continuation of an introduction, I'd say. So it talks a little bit about the applicant's background and kind of their experience and what they went through. And then they transition into why they decided to go pre-med in college and their first clinical experience. So this is where we get into kind of moving on from our initial story or the first part we discuss in our personal statement, which is really a lot about who you are, and we go into like some of those actually examples of how you are committed to medicine and kind of the theme you're going with.
Mhm.
Um, so how do you think they did in this part of the personal statement, Brogan?
Yeah, I am still reading it, sorry.
Yeah, I'm like you on the spot. You're the one and only.
Um,
That's okay. Yeah, take your time.
I like how they kind of brought up, what they thought their takeaway from the experience would be, but
Hmm.
then it seems like they kind of got a much more, maybe not simple, but kind of a realization that they didn't expect, that I'm assuming was probably like like a very nice thing to experience. Let's see.
Yeah, definitely. Right. So, like, what you've learned from the experience and what you took away from the experience. So, as you're writing, those are two really important things, what you got out of it, not just, again, like listing what you did. Right.
Yeah, for sure. And also just, yeah, I don't know. I just I guess I resonate with the like not only listening to, but also, learning from your patients. That's
Yeah,
definitely. Um,
absolutely.
sorry, I'm just reading the second part. Yeah, and then I guess, yeah, it's nice that she kind of, or sorry, they kind of described their experience and then said how it has kind of confirmed what they want to do as a physician.
Mm-hmm.
Um,
Yeah, and this is a good example of how you could tie in, like, if you want to talk about a specific physician and what they did well or what you liked about it. I know that was one of the things you kind of had mentioned that you'd had an experience where you liked what a certain physician did or how they approached the patient. And so I think they did a really good job here of talking about that piece.
mhm,
Yeah.
nice.
Yeah. Um, and so they kind of continue their journey here, right? What happened um after college, right? And now what they're doing in their gap time, which is working for MedServ, which seems like in this case is a pretty significant experience for this person. So it is important that if you do have like one of those significant experiences where you learned a lot, you got a lot out of it, that's definitely something that you mentioned.
Mhm.
Um, yeah, so I think this is just again talking about specific patient interactions and how impactful they were for this applicant. This applicant uses patient names, which, I'm assuming they didn't use actual patient names, but probably made up patient names. So that's a choice too if you want to be like share a specific story about a patient. You can mention a specific story if you want to. Sometimes that makes it a little bit more personal and again keeps the reader kind of interested in what you're talking about, but not everyone does that. Speaking more generally about the patient populations you were serving works as well. Um, so it kind of just depends on your writing style and we can talk about that as we kind of make edits and see what's landing and what's impactful.
Yeah. Do you think that kind of, I don't know, when the applicate or the admissions people are reading this, do they assume that these are like fake names, or do you think like they might think someone was actually saying someone's name? I don't know if that matters, but
Yeah, so usually like, I think they assume that you're not sharing the patient information, which you really shouldn't be, right? I mean, a first name, again, isn't like a full giveaway, but still, I think changing a patient's name to be safe makes sense. So I don't know exactly what they're assuming, but um, I would just always lead on the side of caution and
mhm.
use, yeah, a made up patient name. I think that's usually better, or just saying the patient, you know. That's a good question though. Okay. So, and then this applicant wrapped up with this last paragraph here, um, talking about how they're proud of the work they've done and they look forward to continuing their journey in medical school.
Nice.
Yeah. So that's our first example. The second example is a little different. So, again, it's spread across a couple of slides, but why don't we take a couple minutes to kind of read through how they started their personal statement and then think about what we like about it, what we don't like about it.
I think again with this one, it's kind of nice starting out with the story.
Mm-hmm. I do too. Yeah. I think it definitely is engaging, right?
Yeah. Um,
And it's a unique story, wouldn't you say?
yeah, it is.
Mm-hmm. So it's not a traditional, I do see a lot of folks that'll say, a family member was sick with this and that, which can be okay too, as long as you're, true and specific to your own experience. But this one's really interesting because it's different. She's talking about a tutoring experience
Mhm.
and then relates it back to being and becoming a physician. So I think that's pretty creative. So let's see then what we go into next.
I think this might have just been me, but I think I got confused at first. I thought that they were talking about a doctor they were shadowing for some reason.
Well, so this is another way that people write about patients is
Yeah.
so she just wrote Z, Mr. Z, right?
Yeah.
Um, yeah, so this applicant really just goes right into experiences. So they go right from this story about tutoring right into taking those lessons into research at the VA, right? So it's a less like, I guess, like they don't continue a theme of tutoring or anything, but they
Mhm.
kind of continue this theme of like being able to listen and work with people and kind of meet them where they are at, um,
Mhm.
both in tutoring and in, I guess, kind of like the rehab of Mr. Z. Um,
Yeah, for sure.
and then in the next paragraph, they do a nice transition in the second sentence saying, while the clinical research experience showed me humanity behind science, my work in biochemistry labs show me how showed me how bench research contributes to the understanding of disease. Um, yeah, so sorry, I lost my reading, but so it kind of they go from clinical right into the science. So I like that transition as well because it allows them to talk about a new thing now and talking about their research experience.
Yeah,
Would you?
it's nice to see these, just how I don't
Mm-hmm.
know. I think because I think I was struggling thinking about how to um, tie in maybe these very different experiences into the same sort of, you know, through line. But I think that like this person did a good job in transitioning as well. Um,
Yeah. Yeah, it's not exactly what you would think, but it still flows really nicely, doesn't it?
yeah.
And so this specific applicant had a parent that was a physician as well, which again, we can talk about how much you want to emphasize that. So it looks like they didn't want this to be the emphasis of their personal statement, but also that it was really impactful to have, I think, a mother um, physician. So that's I think why they put it towards the end. Um, Yeah, so this conclusion paragraph really summarizes kind of everything from the last few paragraphs together and answers that why medicine question.
Mhm.
Yeah. Anything you like about this or you find interesting about this last kind of conclusion?
I think it's interesting that she or I think it's nice that she recognized like my strengths are that my patients are being heard even when I have a limited amount of time to offer because she's kind of witnessed like her or their mom kind of being, extremely busy, obviously,
Right.
having to juggle tons of things. So I think mentioning that you kind of know what you're, what you know what to expect, I think that's definitely nice.
Right. Right. Good. Awesome. So I think it can be helpful just knowing that like you can do this, right? And like you can kind of do it a couple different ways and it's probably going to be okay. And they like I just like those two, they all look very different. I know we in this presentation are saying like have a theme and have some examples, but you can do that in a lot of different ways. So hopefully
Mhm.
you kind of saw that.